Imagine waking up one morning with a small pain. Nothing dramatic, just enough discomfort to notice. You tell yourself it's probably nothing. Maybe you slept wrong. Maybe it'll go away. You check the clock, get dressed, and head to work anyway. Because in America, getting sick doesn't start with fear of pain. It starts with fear of cost. Before you even think about what's wrong with your body, your mind jumps somewhere else. How much is this going to cost me? Can I afford to miss work? Do I really need to see a doctor? Or can I wait out? Those questions hit fast, almost automatically. And that moment right there is where the hidden cost of getting sick begins. Most people think the cost of illness is the hospital bill, or the prescription, or the insurance deductible. But the real cost starts long before you ever step into a clinic. It starts in your head, in the hesitation, in the calculation, in the silent debate you have with yourself about whether your health is worth the financial risk. In America, sickness forces you to become an accountant before you become a patient. You don't just ask, "What's wrong with me?" You ask, "Is this bad enough?" You ask, "Can I push through?" You ask, "What happens if I don't?" And for millions of people, the answer is always the same. You wait. You wait because even with insurance, nothing feels predictable. You wait because one visit can turn to 3 bills. You wait because you've heard the stories. Someone went in for a simple test and walked out with a charge they couldn't explain. Someone followed all the rules and still got denied. Someone did everything right and still ended up in debt. So you wait. You take over-the-counter meds. You Google symptoms at midnight. You promise yourself that if it gets worse, you'll go. And sometimes it does get worse. Not because it had to, but because delay is built into the system. This is the first hidden cost of getting sick. Delay. Delay doesn't show up on a bill, but it shows up in outcomes. What could have been simple becomes complicated. What could have been treated early becomes chronic. And what could have been affordable becomes expensive. But that delay isn't laziness. It's not denial. It's learned behavior. People learn early that healthcare in America is not designed to feel safe. It's designed to feel risky. Every visit feels like opening a mystery box. You don't know what you'll owe until weeks later, when the bill arrives and the numbers don't match what you were told. So people protect themselves the only way they know how, by avoiding care unless absolutely necessary. And absolutely necessary becomes a very high bar. For hourly workers, getting sick costs more than money. It costs time. Missing a shift might mean losing income. Losing income might mean falling behind on rent. Falling behind might mean late fees. Late fees turn to stress. Stress makes you sicker. That's another hidden cost. The chain reaction. There are people who go to work with fevers, with injuries, with pain that would make anyone else stay home. Not because they're tough, but because they don't have a choice. Paid sick leave isn't universal. For many workers, staying home means not getting paid. And not getting paid means choosing which bill won't get covered this month. So illness becomes a negotiation. Can I work through it today and rest later? Can I save the doctor visit for next week? Can I hold on just long enough? That constant bargaining takes a toll. Not just physically, but mentally. You're never fully focused on getting better. You're focused on surviving the consequences of being sick. And the stress doesn't stop when you finally do seek care. Walking into a medical office doesn't feel like relief. It feels like anxiety. You worry about what they'll find, but you also worry about what it'll cost. Even insured patients often don't know what's covered. Deductibles reset. Networks change. One provider is covered, another isn't. One test is approved, another requires authorization. So you sit in that waiting room with 2 fears at the same time. Fear of diagnosis. Fear of debt. That combination is uniquely American. In many places, sickness is scary because of the illness itself. In America, it's scary because of the aftermath. What happens after you get treated? What arrives in your mailbox weeks later? What you'll have to explain to your family? What balance you'll carry quietly for months or years? And then there's the bill. The bill is never just a number. It's a message. It tells you how much your health is worth in dollars. It reminds you that care is conditional, that healing comes with strings attached. And for people already living close to the edge, that message hits hard. Some people put medical bills on credit cards. Others set up payment plans that stretch for years. Some ignore the bills until collections call. Some damage their credit trying to stay alive. This is another hidden cost. Financial scars. Even after you recover physically, the financial impact lingers. A lower credit score, less savings, fewer options, more stress the next time something goes wrong. And something always goes wrong eventually. Health problems don't come one at a time. They stack, they overlap, they repeat, and each time the cost compounds. What makes this even heavier is how invisible it all is. From the outside, someone looks fine. They're working, they're smiling, they're functioning. But underneath, they're managing payments, dodging calls, making decisions based on fear, not health. And because talking about money is uncomfortable and talking about illness is personal, people don't share these stories openly. They carry them alone. Silence becomes part of the system. People feel ashamed for struggling, ashamed for getting sick, ashamed for needing help, as if illness were a personal failure instead of a human reality. That shame keeps people quiet. Quiet keeps the system from being questioned, and the cycle continues. Another hidden cost is trust. When people feel like they can't trust the healthcare system, they stop engaging with it fully. They skip follow-ups. They avoid preventive care. They don't ask questions because they're afraid the answers will cost more. They stop seeing doctors as partners and start seeing them as potential financial threats. That's not how healthcare should feel, but that's the environment many Americans live in. Preventive care is supposed to save money and lives. But when access feels risky, prevention gets delayed. Screenings get skipped. Small problems grow silently. And by the time care is unavoidable, it's no longer cheap or simple. This is where the system becomes expensive for everyone. Not just patients, but hospitals, insurers, employers. Late-stage care costs more. Emergency care costs more. Chronic illness costs more. Yet the burden falls hardest on the people least able to carry it. Low-income families, gig workers, freelancers, people between jobs. Anyone without stable coverage. Anyone with a high-deductible plan. Anyone one emergency away from financial trouble. Getting sick exposes how fragile life can be when healthcare is tied to employment, income, and paperwork. Lose your job, you might lose coverage. Lose coverage, care becomes unaffordable. Delay care, health worsens. Worsening health makes working harder. And suddenly, sickness isn't just a health issue. It's a life issue. And that fear changes behavior. People downplay symptoms. They avoid ambulances. They leave hospitals early. They refuse tests. Not because they don't care about their health, but because they care too much about what sickness could cost their family. Parents do this constantly. They put themselves last. They delay their own care to protect household finances. They power through pain because kids need food, rent needs paying, life keeps moving. That sacrifice is rarely acknowledged. Instead, society praises resilience without asking why it's necessary. It celebrates people who push through without questioning the system that forces them to. But pushing through has consequences. Bodies remember neglect. Stress accumulates. Problems don't disappear just because you ignore them. They wait. And when they return bigger. This is the cruel irony. Trying to save money by avoiding care often leads to higher costs later, financially and physically. Yet people keep making that choice. Not because it's irrational, but because it feels like the only option in the moment. This is the hidden cost of getting sick in America. Not just the bill, not just the debt, but the constant calculation, the fear-driven decisions, the long-term damage done quietly over time. And we're only scratching the surface. Because once illness enters your life, it doesn't just affect you. It affects relationships, work, mental health, identity. It changes how you see your body, how you see the future, how safe you feel in your own life. When sickness doesn't go away quickly, something else begins to change. At first, you tell yourself it's temporary, a rough week, a bad month. But slowly, quietly, the idea settles in that this might not be short-term. And that realization hits harder than the symptoms themselves. Because in America, long-term sickness doesn't just affect your body. It reshapes your entire life. Chronic illness doesn't arrive loudly. It creeps in. It shows up as fatigue that never fully leaves, pain that becomes familiar, appointments that start stacking, medications that refill every month. And with each step, the financial pressure grows heavier, even if the illness stays the same. Insurance plans are built around the idea of occasional care, not constant care. Deductibles reset every year. Coverage limits quietly appear. Médication change-tiers. What was affordable one year becomes expensive the next. And every January feels like starting over, not healthier but poorer. This creates another hidden cost. Instability. When you're sick long-term, you can't plan the way healthy people do. You don't know how many good days you'll get in a month. You don't know when symptoms will flare. You don't know if your body will cooperate with your schedule. Employers say they value health, but the system rewards consistency. Showing up every day, being available, being reliable. Chronic illness makes reliability unpredictable, and unpredictability is punished. People start using vacation days as sick days. When those run out, they use unpaid leave. When that's gone, they push themselves back to work too early. Healing becomes secondary to survival. And every time someone pushes past their limits, it costs them something. Energy, progress, hope. Mental health takes a hit here too, and not in obvious ways. There's the constant anxiety of waiting for bills, the fear of opening mail, the stress of phone calls with insurance companies where nothing is clear and everything feels like a fight. You explain your situation over and over to different people who don't know you and don't have the power to help. That kind of stress doesn't turn off. It follows you home. It sits with you at night. It shows up when you're supposed to rest. And rest becomes harder when your mind never feels safe. Depression and anxiety often grow quietly alongside physical illness. Not because people are weak, but because they're exhausted. Exhausted from managing symptoms. Exhausted from managing money. Exhausted from pretending everything is fine. Mental health care is supposed to help, but it has its own barriers. Therapy sessions are expensive. Coverage is limited. Finding a provider takes time and energy that sick people don't always have. And even when help is available, stigma keeps many from seeking it. So people cope alone. They normalize pain. They normalize sadness. They normalize being tired all the time. And society reinforces this by praising productivity over well-being. There's also a loss of identity that rarely gets talked about. People don't just lose health. They lose versions of themselves. The energetic version, the dependable version, the future plans version. And replacing those identities takes emotional work that no one prepares you for. When illness limits what you can do, you start measuring your worth differently. You feel guilty for resting, guilty for canceling plans, guilty for needing help. Guilt becomes another invisible symptom. Families feel this too. Partners take on more responsibility. Kids notice changes. Financial stress affects conversations. Arguments happen over money, time, energy. Illness becomes a shared burden, even when no one says it out loud. And because healthcare is fragmented, families often become coordinators. Scheduling appointments, tracking bills, managing paperwork, advocating during hospital visits. This unpaid labor adds up, especially when caregivers are also working full-time. This is another hidden cost. Emotional labor. Nobody budgets for it. Nobody acknowledges it. But it drains people just as much as medical bills. For people without strong support systems, the weight is even heavier. Single parents, immigrants, gig workers, those without flexible jobs or family nearby. Getting sick exposes how alone someone really is in the system. And then there's the fear of one major emergency. A sudden hospitalization, an unexpected diagnosis, an accident. Even with insurance, these moments can destroy years of financial stability. Deductibles, co-pays, out-of-network charges, lost wages. It stacks fast. People don't just fear getting sick. They fear being ruined by it. That fear shapes life choices. People stay in jobs they hate because of health insurance. They avoid career risks. They delay starting businesses. They postpone moving. They don't chase opportunities because stability feels safer than possibility. This is called job lock, and it's more common than people admit. Health insurance becomes a leash. It ties people to employers, not because the job is good, but because the alternative feels dangerous. Losing coverage feels like gambling with your life, and that fear keeps wages low and mobility limited. Another cost, hidden but powerful. The system also treats people differently based on income and education. Those who understand how to navigate insurance, negotiate bills, and advocate for themselves often fare better. Those who don't get overcharged, denied, or ignored. Complexity becomes a filter that rewards privilege. If you know the right questions to ask, you might save thousands. If you don't, you pay quietly. And people blame themselves for not knowing, instead of questioning why healthcare requires expert-level knowledge to survive. This self-blame is corrosive. People think they made bad choices, that they should have read the fine print, that they should have planned better. But no one can plan perfectly for illness, and no one should have to. Illness isn't a budgeting mistake, yet the system treats it like one. This creates a culture where health feels conditional, where being well is treated as a personal achievement instead of a shared responsibility, and where getting sick feels like failing a test you didn't know you were taking. And still, people keep going. They keep working. They keep paying. They keep managing, because stopping feels impossible. But something important happens when people live like this for long enough. They stop expecting care to care about them. Healthcare becomes transactional, impersonal, something to survive, not trust. And once trust is gone, engagement drops. Outcomes worsen. Costs rise. Everyone loses. This isn't because people don't value health. It's because the system makes valuing health feel dangerous. And the most painful part is how normal this has become. We hear stories like this every day and shrug. We call it reality. We call it adulthood. We call it how things are. But normal doesn't mean acceptable. And this story doesn't end with sickness. It continues long after recovery, if recovery even comes. Because the final hidden cost of getting sick isn't medical. It's how it changes how people see the future. When people finally start to feel better, when the symptoms ease or the treatment works, there's a moment of relief. A quiet moment where the body feels lighter. But that relief doesn't last long, because then reality shows up. The illness may be gone, but the consequences are still sitting there, waiting. Bills don't disappear just because you recovered. They arrive weeks later, sometimes months later. Separate envelopes, separate charges, a doctor bill, a lab bill, a facility bill, each one with its own due date, its own explanation that barely explains anything. And suddenly, you're sick again, just in a different way. This is where many people realize that getting sick in America doesn't end when you heal. It ends when you finish paying. And for some people, it never really ends at all. Medical debt has a way of blending into everyday life. It becomes part of the background, a monthly payment, a balance you try not to think about, something you promise yourself you'll deal with later, when things are better. But later keeps getting pushed back. Savings that took years to build disappear in months. Emergency funds become medical funds. Credit cards meant for travel or emergencies get maxed out just to stay afloat. And the future you were planning quietly changes shape. People delay buying homes. They delay having kids. They delay going back to school. Not because they don't want those things, but because illness already took more than its share. And the hardest part is how invisible this loss is. No one sees the life you didn't live. No one sees the plans you quietly let go of. They just see that you're better now and assume everything returned to normal. But normal shifted. Trust in your body changes. Trust in the system disappears. You start living with a new awareness that health is fragile and financial safety is thinner than you thought. And that awareness never really leaves. This is why people who've been sick often seem more cautious, more tired, more serious. They've seen how fast things can fall apart. Credit scores often take a hit here. Missed payments, collections, negotiations that go wrong. And once credit drops, everything else gets more expensive. Loans cost more. Insurance costs more. Housing options shrink. Sickness becomes a multiplier. One health issue creates financial instability. Financial instability creates stress. Stress affects health. and the cycle tightens. What's cruel is that none of this shows up on a medical chart. Doctors don't measure financial stress. They don't track fear of debt. They don't ask how many nights you stayed awake worrying about bills. But those things matter. They affect healing. They affect mental health. They affect longevity. People adapt because they have to. They learn to negotiate bills. They learn to ask for itemized statements. They learn to fight denials. They become experts in a system they never wanted to understand. This resilience is impressive, but it shouldn't be required. And yet, there's something powerful that happens when people start sharing these experiences. When someone finally says out loud, "Getting sick almost ruined me," others nod, because they've been there too, or they're afraid they will be someday. These stories cut across politics, across backgrounds, across beliefs. Illness doesn't care who you are, and the system treats far too many people the same way once they're vulnerable. That's why talking about this matters. Not to scare people, not to shame anyone, but to break the silence. Because silence protects broken systems, and stories challenge them. If you've ever delayed care because you were afraid of the cost, you're not alone. If you've ever opened a medical bill and felt your stomach drop, you're not weak. If you've ever felt ashamed for struggling after getting sick, that shame doesn't belong to you. It belongs to a system that makes health feel like a financial risk. The hidden cost of getting sick in America isn't just money. It's peace of mind. It's security. It's freedom. It's the ability to focus on healing without fear. And until that changes, people will keep making impossible choices between their bodies and their bank accounts. So if this story felt familiar, if parts of it sounded like your life or someone you love, don't keep it to yourself. These conversations matter more than people realize. Drop a comment and share your experience, or even just say, "This happened to me too." Your voice might help someone else feel less alone. And if you think this is something more people need to hear, share this video with them. Not to spread fear, but to spread understanding. Because the more we talk about the real cost of getting sick, the harder it becomes to ignore. Thanks for staying till the end. Take care of your health and take care of each other.